Well, Mr. President, I'm delighted to follow Senator Alexander and was very pleased to hear the news from the CBO that this Alexander Murray proposal not only doesn't bail out insurance companies, as we all agree we should not do, we want to make sure that savings go to consumers, but also that it will save taxpayers $3.8 billion. This is a bipartisan agreement. I applaud the work of Senator Alexander and Senator Patty Murray to craft this bipartisan agreement to address the challenges we have in the short term with health care. Senators Alexander and Murray have given us a template for bipartisan negotiations, not just on health care, but on other critical matters that are going to come before this Senate: tax reform, reauthorizing community health centers and the Children's Health Insurance Program, reaching an agreement on the 2018 budget. These are all major issues facing this country and issues that we should be working on in a bipartisan way, because the Senate is at its best when we observe regular order, when we follow the committee process, when we work across the aisle and make principled compromises to get things done for the American people. I believe that's exactly what this health insurance bill does. In a Senate that's nearly equally divided between Republicans and Democrats, this is the only productive way forward for us to address the challenges that face this country. And too often we have seen people view bipartisan negotiations as a last resort, but bipartisanship should be the Senate's first resort, not the last resort. It should be the foundation of our work in this body. This is how the great majority of Americans want us to conduct the Senate's business. When I travel around New Hampshire, this is the consistent comment that I hear everywhere I go. Why can't you all work together to get things done for this country? This is especially true on matters like health care and tax reform, which affect families throughout the country. I'm encouraged that the Alexander Murray bill has earned strong bipartisan support, and as Senator Alexander said, it has 24 original co-sponsors. That number is equally divided between Republicans and Democrats. And this is a balanced agreement that's been negotiated by both parties over many months, and I think it's our best bet for stabilizing marketplaces in the short run so we can continue to work on long-term issues around health care. I'm especially pleased that this agreement provides for the continuation of cost-sharing reduction payments for 2 years. These payments are necessary to keep premiums, deductibles, and co-payments affordable for working people. Without these payments, the cost of coverage will skyrocket, insurers will leave the marketplaces, and millions of people will lose their health care coverage. I've been working on this issue of cost-saving reduction payments since earlier this year, when I introduced a bill that would permanently appropriate funds for the CSRs. As the CBO said, the language in the Alexander Murray bill ensures that these CSRs are not a bailout to insurance companies, that they are a way to help people with the cost of insurance. They are orderly payments, payments that are built into the law that would go directly to keeping premiums, co-pays, and deductibles affordable for lower-income Americans. Both Democrats and Republicans recognize that these payments are an orderly, necessary subsidy that keeps down the cost of health coverage for everyday Americans. And as Senator Alexander said, we saw that these payments were in the bill that the House voted for around health care, and they were also in the Senate bill earlier this year. Now, in recent months, I've heard from hundreds of people across New Hampshire about the enormous difference that health care reform has made in their lives. We're a small state. We have just about 1.3 million people, and nearly 94,000 Granite Staters have gotten individual health coverage through the marketplaces. Nearly 50,000 have gotten coverage thanks to the Medicaid expansion program in New Hampshire. That has been a bipartisan effort with a Republican legislature and a Democratic governor to get that program in place, and it continues to enjoy the support of the Republican legislature, and the Republican governor. Now, because of the Affordable Care Act's increased access to care, we also have nearly 11,000 Granite Staters who have substance use disorders who've been able to get treatment for the first time. New Hampshire has the second highest rate of overdose deaths from the heroin and opioid epidemic. And having treatment available through the expanded Medicaid program has made a difference for thousands of people in New Hampshire and their families. Hundreds of thousands of Granite Staters with pre-existing conditions no longer face discrimination, resulting in denial or sky-high premiums. These are important achievements, and this legislation will allow us to continue down that road to make sure people have health care coverage that they can afford. For people across New Hampshire and across this country, health care coverage is often a matter of life or death. It's also about being able to take a sick family member to a doctor. It's about knowing that a serious illness will not leave a mountain of debt. So I am very pleased to be able to join in the bipartisan efforts led by Senators Alexander and Murray to strengthen the parts of the health care law that are working and to fix what is not working. The other provisions in this legislation would allow states more flexibility through the 1332 waiver process. The Alexander-Murray Agreement expedites waiver approvals so states can implement smart fixes to stabilize their marketplaces, for instance, by establishing a state-based reinsurance program. The agreement also includes a restoration of funding for open enrollment outreach and educational activities. And it protects core protections related to insurance affordability, coverage, and plan comprehensiveness. All of these changes are positive steps forward, steps that I hope will set us on a bipartisan path to strengthening elements of the Affordable Care Act that are working well and to fixing elements that need to be changed. I'm hopeful that the Alexander-Murray Agreement can gain the bipartisan support it needs to pass in Congress, that it can gain the President's signature, and I was encouraged by Senator Alexander's comments about the President's comments yesterday, because we need to restore certainty and stability to the marketplaces. Instead of partisan efforts to undermine the law and take health insurance away from people, we should embrace the spirit of the Alexander-Murray Agreement. Let's work together in a good faith, bipartisan effort to build a health care system that leaves no American behind. Thank you, Mr. President. I yield the floor.